Before discussing the causes, I'd like to first identify the various types of depression. First, major depressive disorder, also known as clinical depression, is the most common form of depression, with approximately 6.7% of the U.S. population over the age of 18 who suffer from repeated episodes, and 20 to 25% who suffer at one point in their lifetime. It is characterized by having a series of symptoms that interfere with everyday life, that is, a person's ability to work, sleep, eat, or enjoy everyday activities. Clinical depression may occur only once in one's life. However, it is more common that an individual who suffers from this form of depression receives repeated episodes throughout their lifetime. For it to be considered clinical depression, the patient must exhibit daily symptoms of either depressed mood or loss of interest for a minimum of 2 weeks. It is not considered clinical depression if the symptoms are induced due to substance or medical conditions such as hypothyroidism. A person with classic major depression has at least 5 of the following 9 symptoms: fatigue or loss of energy almost every day, feelings of worthlessness or guilt, impaired concentration, indecisiveness, insomnia, hypersomnia, markedly diminished interest or pleasure in almost all activities, restlessness or feeling slowed down, recurrent thoughts of death and suicide, and significant weight loss or weight gain. Chronic depression, or dysthymia, is far less common, with 1.5% of adult Americans suffering from it. They have similar symptoms as major depression, however they are exhibited to a lesser degree and may not disable the person. In addition, the depressive episodes for an individual suffering from chronic depression may last 2 years or longer. If you suffer from a chronic depression, you are at a high risk for clinical depression. Atypical depression has the same symptoms as major depressive disorder, however they differ in mood reactivity. Someone with atypical depression will have a mood improvement if something positive occurs, however this is not the case for clinical depression. Diagnostic criteria call for at least 2 of the following symptoms to accompany the mood reactivity: hypersomnia, increased appetite or weight gain, having more intense reactions or increased sensitivity to rejection, resulting in problems with social and work relationships, having a feeling of being weighed down, paralyzed, or leaden. For the depressive side of the symptoms, it has the exact same symptoms as major depressive disorder, however it also includes restlessness and irritability. The signs of mania with bipolar disorder include disconnected and racing thoughts, grandiose notions, inappropriate elation, irritability and social behavior, increased sexual desire, talking speed and/or volume, markedly increased energy, poor judgment, and severe insomnia. Seasonal affective disorder, obvious in its name, occurs with the changing of seasons. People who suffer from SAD tend to be less happy the farther you proceed into winter. This may also occur during summer, however this is a far less common variation of SAD. The severity of the symptoms varies from person, from feeling irritable to symptoms that interfere with daily life. People with SAD have many of the normal signs of depression, including decreased levels of energy, difficulty concentrating, fatigue, increased appetite, weight gain, increased desire to be alone, and increased need for sleep. Psychotic depression includes psychosis, which usually includes hallucinations and delusions such as believing their thoughts can harm them. People with other mental illnesses such as schizophrenia also experience psychosis, but those with psychotic depression usually have delusions or hallucinations that are consistent with the themes of depression, such as worthlessness or failure, whereas psychotic symptoms in schizophrenia are often bizarre or implausible and have no obvious connection to mood state. Common symptoms for patients who have psychotic depression include agitation, anxiety, insomnia, intellectual impairment, physical immobility, delusions, and hallucinations. Neurotransmitters are chemicals which relay messages from neuron to neuron. When a neuron becomes activated, it passes an electrical signal to where the neuron transmitters are stored. Neurotransmitters are then activated and move into the synapses. As the concentration rises, neurotransmitters bind with receptors at the end of the 2 neurons. The release of a neuron transmitter from one neuron can activate or inhibit the second, passing an electrical signal or message, or if the neuron transmitter is inhibitory, stopping that message. One reason depression occurs is because this system falters. Receptors may be oversensitive or insensitive to a specific neuron transmitter, causing their response to be either excessive or inadequate. In addition, the message might be weakened if the originating cell produces too little of the neurotransmitter, or if they were overly efficient and the neurotransmitters are removed before they have a chance to bind to the receptors. Antidepressant medication usually increases the concentration of neurotransmitters in the synapses in order to ensure the proper dosage is received. Some neurotransmitters that play a key role in depression are serotonin, which helps regulate sleep, appetite, mood, and inhibits pain. Research supports the idea that some depressed people have reduced levels of serotonin transmission, seeing as lower levels of serotonin have been linked to higher risk for suicide. Norepinephrine constricts blood vessels, raising blood pressure. It may also trigger anxiety and be involved in certain types of depression. Then there's dopamine, which assists in the controlling of the brain's reward and pleasure center, and thus is essential to motivation. It allows us to identify rewards and take actions for them. Because of this, it plays a significant role in substance abuse. It also plays a role in how a person perceives reality, and because of this, problems with dopamine transmissions have been associated with psychosis. Gamma-aminobutyric acid is an amino acid that researchers believe act as an inhibitory neurotransmitter. It is thought to help quell anxiety. Seeing as mood is affected by dozens of genes, the severity of depression will be affected by genetics. Mood disorders have a tendency to run through families. For example, one study of identical twins showed that if one twin has bipolar disorder, the other has a 60 to 80% chance of developing it as well. A person who has a close relative who has suffered from major depression has an increase in the risk of acquiring the condition themselves. Genetics also affect one's reaction to stress, making them either more susceptible to stress or better at coping with it. Stress triggers a chain of chemical responses in the body. If the stress is short-lived, the body usually returns to normal. However, long-lasting changes may occur if the stress becomes chronic. When you are under physical or emotional stress, the hypothalamus secretes a corticotropin-releasing hormone, aka CRH, which rouses your body and assists in the creation of the fight-or-flight response. Normally, a feedback loop allows the body to turn off the fight-or-flight response once the threat has passed. In some cases, however, the floodgates do not close properly, and the cortisol levels rise too often or simply stay high. This contributes to problems such as high blood pressure, immune suppression, asthma, and eventually possibly lead to depression, seeing as several studies have shown that people who are depressed or have dysthymia typically have increased levels of CRH. CRH also affects the cerebral cortex, part of the amygdala and the brainstem, as well as influences the concentration of neurotransmitters throughout the brain. This chemical is thought to play a major role in coordinating your thoughts, emotional reactions, and behaviors, both voluntary and involuntary. Finally, there may be a medical cause. Medical illnesses or medications cause 10 to 15% of all depressions. For example, issues with the thyroid can trigger manic symptoms as well as exhaustion and depression. While certain illnesses can trigger depression, it may be the stress of the situation that causes it to occur. However, once the medical condition is treated, the depression should lift. The following medical conditions have been associated with mood disorders. There's degenerative neurological conditions such as multiple sclerosis, Parkinson's disease, Alzheimer's disease, and Huntington's disease. Stroke, some nutritional deficiencies such as lack of vitamin B12, other endocrine disorders, such as problems with the parathyroid or adrenal glands that cause them to produce too little or too much of a particular hormone. Certain immune system diseases also cause depression, such as lupus, some viruses and other infections, such as mononucleosis, hepatitis, and HIV, and finally, cancer.